All right. This is a book that I published in 2007. As I told you, I would really like to be able to give it all to you for free, but it's still a national bestseller, and you'll have to get it through some book dealer. But if you want the basic information for free, it's in my 2002 newsletters. So, not with the humor, enjoyment that this book is written, but yeah, but in the form of the information and the scientific references, what we talk about over the next few weeks, you'll be able to easily find in my 2002 newsletters. So the first thing I want you to know, you need to go to the back of the book to do this, I think. It doesn't show a good picture of him, but there is a great picture that I'd love to have shown you of this man right here. His name is Howard Bartner. Howard Bartner, and he was the head medical illustrator of the National Institutes of Health. I met him online. He emailed me, so it was more than many more than 10 years ago, maybe 15 years ago. He had medical illustrator of the National Institutes of Health, so he worked with doctors all the time. And Howard got into trouble himself, and he emailed me and he asked for help. And I got him out of trouble. We don't need to go into the details, but he wasn't even a patient. And like with many of you, you've written me, I've given you information, enough information for you to take another approach. So I did this for Mr. Bartner, extremely talented man. He did all the illustrations for this particular book. How that came about was in 2001. Mary and I and Howard and Elaine, we went on a trip, one of our McDougall adventure trips to the inner passages of Alaska. And we were on a small boat, about an 80 passenger boat. And they had no slide projector. So as a result, I had to convey my message without any slides. And that meant I had to do drawings. And my writing talent is let's just say I would starve to death if I had to make my living drawing illustrations like Mr. Bartner has done his whole life. Well, he was in the audience very frustrated with what I was doing. And as a result, he volunteered to help me express myself, to better communicate. And so after a little discussion, he was willing and able to draw all the illustrations that are in this book. And I can't give enough praise to Howard Bartner. Well, anyway, we were going to talk about Chapter 4, and Chapter 4 is about gastrointestinal reflux disease, pretty much. It's about GERD, which affects a good share of our population. How do I know this? Well, I go to the drugstore, the grocery store, and for sale in the U.S. Are medications for GERD. They're called proton pump inhibitors. They are effective, but they are toxic. And they are sold over the counter in the U.S., maybe some other parts of the world, because indigestion is so common. That means pain in the stomach is so common, and reflux is so common, it's an everyday occurrence for most people. So here's the chapter. My stomach's on fire, and I can't put it out. It's Chapter 4. Well, the reason people's stomachs are in trouble, it's going to be a big step for you. So, don't get too shocked when I tell you this. The reason people's stomachs are in trouble is because of the food they put in their stomach. But there's some short-term and long-term effects on the stomach from putting the wrong things in. Those of you who are longtime listeners, you know what the right thing to put in the stomach is, and that's starch. Potatoes, sweet potatoes, corn, rice, some beans, peas, and lentils, a little fruit, some non-starchy vegetable stuff like kale and broccoli. That's what you put in your stomach to make it healthy. Well, people, what they do is they swallow the food, not just 3 times a day, but maybe 14 times a day. They swallow the food, and if you'll notice this picture here, this is a picture of a stomach. And one of our characters are Larry and Louise, and you can read about them, see pictures of them. But here's a picture of the stomach. And you see what would be on, this side. This side right here, this stomach. This stomach, its lower esophageal sphincter is open. This stomach, the lower esophageal sphincter is closed. That's the way it's supposed to be. It's closed right there. And when you swallow, what happens is this sphincter opens up and the food goes into the stomach. Between meals, this sphincter is supposed to be closed, so the stomach contents can't reflux up into the esophagus. But when you eat the Western diet, you destroy the physical competence of the sphincter. And we'll get to that later in our discussion of how that happens. But I'll give you the bottom line. It's from chronic straining, from chronic constipation. It ends up destroying the support for the sphincter. And if you read ahead in the book, you'll see how. And now what happens is the stomach contents can constantly reflux up into the esophagus. You see that? And that's what GERD is, gastroesophageal reflux disease. And it burns the lower part of the esophagus, causing esophagitis. And when it burns it really bad, we call it Barrett's esophagitis. And then as it burns further and longer, in some cases it turns into adenocarcinoma of the esophagus, which is essentially, it's a very bad disease, and it's essentially untreatable in terms of cure. You can go in and take out the tumor, rearrange the esophagus and stomach and intestines, and you can do some good. This is a what do they say? What do our national leaders say? This is a real bad thing to have aphasia. Anyway, it's a mechanical change. You can't fix it except by mechanical means, which would be a surgeon going in and pulling the sphincter back down in its proper position, supported by the diaphragm, and kind of sewing it back down there. You don't want to do that, because you can relieve the GERD, the reflux, by putting good things in the stomach. What causes acid and acid irritation is eating animal foods, primarily animal proteins, dairy proteins. Yes, dairy proteins cause a lot of acid secretion. And other things like drinking coffee and decaf coffee causes a tremendous amount of acid production, which then refluxes it up into your esophagus. So you want to put good things in your stomach, and then the reflux won't bother you in most cases, just by putting good contents in there. And then the other thing I have people do is I have them raise the head of their bed. Because of gravity, if you raise the head of your bed, you can see here that gravity will pull the contents of the stomach out of the esophagus and back into the stomach if you just raise the head of your bed by about 4 inches. And you can do this with a brick or a 4x4 or whatever, about 4 inches you raise it. And so gravity pulls the acid out of the esophagus, keeps it in the stomach. And this is good. So you eat good things, you get a little gravity working for you. You can also take antacids, and the antacids I prefer would be wafers or liquids, like Tums is an example, whatever brand of antacid you want. And then if that doesn't solve it, then I go on to H2 blockers, which are antacid pills, which are, they're not safe, but they're better than the next category, which are proton pump inhibitors. And proton pump inhibitors are very dangerous. I almost never prescribe them. It's a very last result. There's just an article, unfortunately, my water glass got on it, but you can look that up. It's open access. It came out December 2016 in Kidney International. And you can look it up under Kidney International. You can just look up the article title under Google. Let's see if I can give it to you right there. See that? Sorry about the loss of the corner. Okay, what it says here is that these proton pump inhibitors result in kidney injury. They also cause osteoporosis. They also increase your risk of having lung infections, all kinds of things. You could go on forever in terms of the side effects of these things like Prilosec and Nexium and so on. These are proton pump inhibitors. You don't want to go there if you don't have to. So if you have indigestion or you have GERD, reflux, then you want to put good food in, which is starch, fruits and vegetables. I do have to add one caveat, very important, is that raw vegetables, particularly onions, particularly raw onions, green peppers, cucumbers, and radishes. They will cause a lot of indigestion in people. I mean, these are healthy foods, but they cause horrible indigestion. Now, cooked, they're well tolerated. If you come to our 10-day program, when we serve burgers, usually on Wednesday, Jeff Novick makes a burger and Mary makes a burger without blood vessels, by the way. We make burgers. And as part of the toppings, the condiments, we have cooked onions, and they really go well with the burgers. So you want to be careful about raw food if you have indigestion. Cooked food is so much better tolerated. Well, all right. So you've got this reflux condition. You're going to solve it for now by eating well, raising the head of your bed, and using, say, wafer antacids like Tums as needed. You may go to antacids such as H2 blockers as a next result. You take them as needed. Of course, you discuss it all with your healthcare provider. And you use proton pump inhibitors as a very last resort because they're so dangerous. Now, when you get the reflux, let me tell you this picture right here in the book. Let me hold it up for you. All right, a little closer, I think you can get it. This is a picture. You see the stomach, you see the esophagus. What I'm trying to show you here is reflux up the esophagus that burns the lower esophagus, causing esophagitis, and the reflux continues and the stomach contents go up into the area of the vocal cords where it crosses chronic cough and laryngitis. You see the vocal cords up there by the chin. And then the reflux goes further up into the sinuses, causes sinusitis, gets on your teeth, takes the enamel off your teeth, the acid does from your stomach, and then you inhale the acid contents of the stomach, and it burns the airways, the bronchial tubes, and you get bronchitis and asthma and emphysema eventually, and all kinds of terrible things. So this acid reflux is a big deal. And the way you got the reflux in the first place, we'll discuss later on. And the way you got this reflux is you destroyed this lower esophageal sphincter by chronic straining, secondary to constipation. But it's a mechanical problem. You can't fix it except by mechanical means, which is surgery. And you really don't want to do that unless there's no other choice. So, Gustavo, I'm assuming we're still in contact. I'd like to turn the stage back over to you if we could.
That when you're talking about food, you are talking about also not ingesting anything like oil and any other.
Oh yeah. Fats. Of course, we've done many topics on this.
Right.
Because fatty food. I showed you the mechanical change that occurs by repositioning the lower esophageal sphincter from the abdomen, supported by the diaphragm, up into the chest. That's through many years of constipation, straining. But you also have short-term effects on the lower esophageal sphincter, which relaxes that sphincter and causes you to have GERD. And the short-term effects are primarily caused by eating fat. And then you get reflux from, fats, any kind of fats and oils. There are other things that cause it. There are various medications that relax that sphincter. Chocolate relaxes the sphincter. Yeah. So.
All right. Good.
Yeah, that's what I'm talking about in terms of that sphincter. And, maybe I should just go just for one more statement about the coffee and decaf, because it's a big deal for people.
Yes.
And the research, by the way, all the research, what I'm talking about, is found on the website for free. 2002 newsletters would be a good source, or you can just put coffee or decaf in the search engine. You'll find the scientific references. But coffee has alkaloids in it. I'm not talking about the caffeine. It has alkaloids in it that cause acid secretion, a tremendous amount of acid secretion. And if you take the caffeine out and you make decaf coffee, you get as much secretion of acid because it's not the caffeine, it's the alkaloids, the other chemicals that are in the coffee bean. So some people, they will switch to decaf because of the jitteriness caused by caffeine. and they'll go to decaf and they'll say, my stomach hurts just as badly. Well, that's because it's not the caffeine that causes the acid production and the indigestion. Any serious coffee drinker carries around a pack of antacids to relieve the indigestion. It's almost universal. The other thing I wanted to mention is the timely recommendations to drink milk for ulcers. This is untrue. Milk actually makes acid secretion worse because of the milk protein and the calcium in the milk. So you're just going to increase acid secretion. You are never going to heal ulcers. We used to try this when I was a young student. This dates back almost 50 years ago. We would feed people milk to cure their ulcers. And scientific studies show that it never worked. And then we'd feed them a special diet called the SIPPY diet, SIPPY diet, which was antacid, like Maalox or Tums or liquid antacid. We give them, people with ulcers and terrible indigestion, we give them a dose of that, and then we give them a dose of half and half the next hour. That's milk, half and half. And what they found with follow-up with these people, first of all, they had no improvement of ulcer healing compared to being on no regime at all. And second of all, 2 studies done, one in Britain, one in the US, showed on follow-up that they had 2 to 6 times as much risk of dying of heart disease because of the dairy part of the SIPPY diet. So you don't want to fall into that nonsense, which has been proven to be nonsense for at least 40 years. You don't want to heal ulcers that way. And maybe we'll get into that more next week. Maybe we'll get a chance to talk about actual stomach ulcers, right. Bacterial infection. So those are just a couple.
Okay. Dr. McDougall, how about tea? Since tea wouldn't have the chemicals, maybe, that you're referring to in coffee, would it be okay to drink tea even if it's caffeinated?
I find most people tolerate tea well. And, most of us like to get high, too. So consuming substances that make us high,
that's
like
right.
caffeine, is fun. And most people can get away with black tea as far as effects on the cardiovascular system. Coffee raises cholesterol.
Right.
Yes, it does.
Right.
And triglycerides. A decaf coffee does the same and maybe even worse.
Mm-hmm.
Black tea, I find in my clinical experience personally, as well as my read of the scientific literature, black tea is well tolerated. You still get a little buzz. Mm-hmm. And it has no effects in terms of adverse cardiovascular disease. But some people are sensitive to teas too. And if it bothers you, if you drink it or eat it and it hurts, listen. Do something about it. Don't do it.
Listen to your body, right? But herbal tea would be fine then.
Well, it depends. Again, herbal teas can mean lots of things. There's cannabis herbal tea.
That's right. That's right.
Herbal tea doesn't mean a lot to me. In general, I've found most things promoted as herbal teas for health benefits have been lackluster. I haven't seen any great improvements in people's health by switching to herbal teas. It's not the problem. The problem is food poisoning from animals and oils. So herbal tea will probably work out for you, but you're the ultimate gauge of that in deciding, does it hurt?
Right. Dr. McDougall, a question from one of our viewers here. My doctor put me on Prevacid 17 years ago, and I have been taking 30 milligrams a day ever since. How do I safely and effectively get off of this medication?
Okay, well, of course, you're going to talk to your doctor because I'm not your doctor.
Right.
But we're going to face more than 40 people tomorrow at the McDougall Clinic in Santa Rosa. And probably 10%, I'm just guessing, probably 10% are on these proton pump inhibitors. And what they will be told the first day by myself and Dr. Lim is to stop these medications. Now, there are some exceptions. They're few, but we'll just stop them, plain simple, stop them. And then the recommendation along with that will be to avoid raw vegetables and also fruit juice. I have to tell you, fruit juice is very disturbing, like orange juice or grapefruit juice, not the orange or the grapefruit. but the juice is very distressing to the stomach. We don't serve juices in our program except for prune juice, which is for another reason. So anyway, they will be told, let's just say I told you 10%, 40 people, 4 people, that's probably too low. But maybe 8 people will be told tomorrow, Saturday, and Sunday to stop taking their proton pump inhibitors. Boom, stop them. And they will. And they'll be told to avoid the raw vegetables and fruit juices. They will be told to eat a starch-based diet. They'll be told to be careful about spices like sriracha sauce and our salsas, but they don't usually bother people, but they could. And then what they will be told if we'll also raise the head of the bed. We do this at the clinic. So this is standard practice for the resort to go in and put 4-inch blocks. We have them all made under the head of your bed. And then what Dr. Lim and I will tell people is, look, if you have some indigestion, go across the street to the pharmacy, which is about 200-300 feet from our clinic, and pick up some Tums or other wafer or liquid antacids and use that as needed. If that doesn't work, pick up some H2 blockers like Zantac and take those as needed. And all along the way, we'll be in contact with these people. Dr. Lim and I will be to know how they're doing, but almost never do they have to restart the proton pump inhibitors. I say almost never. But let's just guess that, I don't know. Let's just guess out of 50 people I asked to stop them, maybe 1 or 2 has to restart them because it's the only way they find relief.
Right.
So I just let my patients stop them. Why not? These things are toxic. Right? I just showed you they cause kidney disease. You can look at this again. It's open access. You can read about it. They cause osteoporosis. And we'll get into that in the next lecture. I'll show you how they cause osteoporosis, how they destroy your bones, increase your risk of hip fractures. The reason they give you more infections in the lungs is because you don't have the acid in the stomach to kill the bacteria that reflux up into your lungs and give you pneumonia that could kill you.
Right.
Anyway.
Right. One sad thing for me to read here was that chocolate, and even worse, dark chocolate, is even worse. So is it because of some of the
alkaloids
present?
Yeah. You know what? And if that's the thing that's keeping you from eating a diet of potatoes, rice, corn, etc., then put chocolate on your dessert list. We actually serve.
Right.
We serve chocolate twice at the clinic.
You do, yes.
We do. Tomorrow night, I believe we have chocolate brownies, or it could be chocolate pudding. And at the end of the program, we have a chocolate pudding. And you were in Hawaii. I'm sure they served a few chocolate desserts there.
Oh yeah, they did. Those desserts in Hawaii were just amazing.
Right.
Wow.
A few people didn't understand they were desserts. They thought they were main course.
I know. Yes, it's not easy to not make them the first course. Dr. McDougall, since one of the symptoms of really bad, GERD disease is that it may seem like a heart attack. How can a person tell if they're having a heart attack as opposed to?
Well, it's very difficult.
So it is difficult.
Yeah, it is difficult because the pain that is created by the esophagus is very similar to the pain that you get when you have dying heart muscle. There are some distinctions. I don't think I've ever been confused myself personally. I find very rarely our patients confused. But when you're having a heart attack, you're in big distress. You feel like, they tell me that you feel like an elephant is sitting on your chest. Yes. Most people know they're in big trouble. Now, there are silent heart attacks, but they're silent. That's just the way it is. You never know about them. If you're having distress to the point where you psychologically, emotionally, or those around you realize that there's something big going on, then you must avail yourself to medical care ASAP. And people suffering from indigestion, at least in my personal and patient experience, they know it's indigestion. The distress is much less, even though the pain may be there. The actual distress that your body's saying, hey, buddy, Got something bad going on here.
Something really bad is happening.
Yeah. Most people, I think, can make the distinction, but it's hard when you get to the ER, the emergency room. The doctors and nurses are going to have trouble figuring out the source of the problem, and the differential diagnosis is a heart attack and, carditis, inflammation of the heart linings, and esophagitis, and costochondritis, pain in the bones. So there's all kinds of things that are going to be thought about. I say, when your body's in trouble and you experience serious distress, likely it's talking to you clearly.
Yeah, it will be clear. Dr. McDougall, you mentioned something that it was very interesting, because so many children have asthma, and you say here that there is a connection.
Yes.
Could you talk a little bit about that?
Well, I would love to. And by the way, all physicians know this and should be practicing this.
Oh.
This is standard discussions in pediatric and pulmonary conferences, that reflux, as I showed you, the refluxed acid is inhaled into the bronchi and causes asthma. It's a leading cause of asthma. There are other causes like the air, etc. But it's a leading cause of easily controllable asthma to stop the GERD. And the most common cause of GERD in children, in my understanding, is cow's milk. Dairy products. They cause horrible indigestion and reflux in children. That's what the science says in my reading. And the first thing, for that reason, and 1,000 others I could give you if I had time, and I do, and I will, you should stop cow's milk unless you're feeding a baby calf in your field. You should not feed it to human being children. This is toxic. This will make them sick. This will make them fat. This will make them constipated. This will cause them GERD. This will cause them severe arthritises and other autoimmune diseases. This is poison to feed the milk designed for a calf to a human being. And the people who do this should be held accountable. I'm still trying to be appointed Surgeon General.
That's right.
The changes that have taken place in the last few months. Couldn't I be Surgeon General? Couldn't I?
Well, I mean, you are, qualified, way qualified. So we just need to sign enough petitions.
Well, it depends on whose business and whose welfare you're
That's right. That is right.
Talking about industry, would I be fired?
Yes, and as you mentioned in your book here, I mean, this industry alone, with just two medicines, Prilosec and Prevacid here, they're making $7 billion. And
that was more than 10 years ago.
And that was more than 10 years ago. And what are they going to make by switching to a plant-based diet?
Yeah, and then people, let's not forget to bring this up, because I know a lot of our listeners are thinking this. People have to decide they're not going to eat the tri-tip steak or consume the brie cheese. A lot of people think, and I know they're busy, their lives are busy, they got bills to pay and spouses to deal with, and what they eat is very low on their list of priorities. And so we say to ourselves, well, I just don't have time. I'm not just important enough. I have too many other things to deal with to fix the problem. What I'll do is I'll take Lipitor for my cholesterol. I'll take an antacid for my indigestion. I'll take a blood pressure pill for my blood pressure. I'll take a laxative for my constipation. I'll wash off my stinky, oily skin with soap, because it's just too hard to change my diet.
Right.
Yeah. Yeah, I understand, but it's never going to work. You're never going to fix the problems until you realize that you must eat potatoes and sweet potatoes and rice and corn. In this day and age, with the Instant Pot, there's almost no excuse, or with the frozen rice available, or easy to cook potatoes, or it's endless, and how effortless you can make this.
Exactly. Dr. McDougall, you also mentioned something that a lot of people I know that they drink, and it is fruit juices. And you mentioned something about disturbing the fiber and perhaps other components. When you talk about fruit juice, do you also talk about smoothies?
Smoothies would fit too.
Yeah. Okay.
The initial thing I want you to think about is you don't improve the nutritional quality of a fruit or vegetable by beating it 1,000 times with a steel blade.
Mm-hmm. Right.
I can go back to research done. I believe the author's name was Heaton, and it was published in, I believe, the Lancet, late 70s, early 80s. I can easily find it for you. But what he did is he took people and he measured their insulin levels and their blood sugar levels. Just stuck a tube in their arm so he could constantly draw blood. And he started out by feeding them a whole apple. And he measured the rise in blood sugar and the rise in insulin. And insulin went up a little bit and blood sugar went up a little bit. And then it went, after eating, down a little bit. And then he took the apple and he ground it up. This is with peelings, stems, seeds, everything. Ground it up in a blender and fed it to them as applesauce. What happened is the blood sugar went up about the same amount. The insulin levels went much higher because you disrupted the fiber. And the resulting blood sugars after 90 to 120 minutes went way low compared to the apple. And then his group separated the pulp from the applesauce and made just sugar and water, apple juice. And the result was the blood sugar went up about the same amount as the apple and the applesauce. The insulin levels went way higher. And the sugar level, the resulting sugar level after an hour or two was much lower. So you do disrupt the fiber. And you also cause changes that I would have to read a little bit more about to see if anybody's investigated it. But the experience I've had is some of you, think about who you are, some of you can just think about a grapefruit juice or orange juice, and you get indigestion just thinking about it. And then if you drank it, you feel the terrible burn. Somehow disrupting this fruit and removing the fiber makes the whatever's left extremely irritating for most of us in terms of the stomach and esophagus. Yeah, you may know this experience. That's one reason we don't serve juices at the program.
Right.
But in the big scheme of things, it ain't a big deal.
Right.
We're talking about people out there that are poisoning themselves with pork chops and hot dogs and chunks of cheese. A little juice is probably not the problem.
Right. I like it when you say that, Dr. McDougall, because it's so easy for many of us. The more we learn, the more we attend to detail, and it is easy to get lost in the detail and lose track of the big picture, which is stop eating the animals and the animal products and the processed oils. And so I thank you for saying that.
Yeah, this is so stupid simple. As we talked about in this lecture.
Well, thank you, Dr. McDougall. That was a great introduction to the book. And I think next week we're going to go back to the beginning and then go chronologically. And
well, do we have Dr. Lyle next
actually,
week?
Not next week, a week from, in 2 weeks. Next week we have Dr. Lyle, and he's going to give us an amazing lecture that I heard about 2 weeks ago on the perfect personality. So that was a very funny and very fun and brilliant, actually, lecture. And I asked him to please present it to all of us. So next week is Dr. Lyle.
That's good. Then I'll be back in a couple of weeks. And thank you all for your patience. We also have something called an intensive weekend coming up in May of 2017. And this is the most inexpensive, fastest, most efficient way to have direct contact with our staff and the message presented in person. And we do that in May. But again, as all of you know, everything is free on the website. no gimmicks. So,
Yes. Yes.
you know, you can go to your
And
public library.
I want to personally invite people to attend, well, any of your programs, but I just want to say that in August, I will be there for the 10-day program that you're doing. And
Oh, yes, you will. I remember you will.
yes, and it's going to be a very special time for me, and maybe later I can share why, but I just want to tell people that I'll be there and to just come and join you and me and get well.
We run one of these programs every couple of months, and we look forward to you. We're here to help.
Yeah.
I know this sounds all overwhelming for many of you, your friends and family. You know, I do understand it, but that's why we run this 10-day program. You know, it's hard to understand algebra and calculus and astronomy, but that's why they have universities and organizations to teach this to you. Well, this is what we do. You know, we're asking you to make some very simple changes, but they're not simple when you've spent a lifetime doing the wrong thing. And you also have to deal with the medical businesses. Believe me, the physicians and the pharmaceutical companies, they worked hard and they spent a lot of money getting you hooked on these drugs. Now, that's a generalization, but it is true. So to get yourself off the medication, sometimes it's difficult.
It is.
But we're here to make the tough decisions with you. And as I've mentioned many times, and we've published, close to 90% of people reduce or stop their medication.
Yeah. Well, you do guide.
Sick people take drugs. You make that your mantra all day long. Sick people take drugs. Sick people take drugs. I don't want to be a sick person. And so I need to get healthy so I don't have to take the drugs.
Mm-hmm.
You know, exactly. Sometimes there are exceptions, but you get the message.
All right, excellent. Well, everybody, make sure you read chapters 1 through 3 for 2 weeks from today, and we will see you then. And thank you again, Dr. McDougall, for being with us today.
Thank you, folks, for listening, and
thank you for your patience.
Yeah, it's your patience.
All right. Goodbye. Have a great weekend.